Hello, I'm Dr. Dennis McKenna. I'm joined again today with Dr. Fred Venditti, our Hospital System General Director. We're giving you the update from Albany Med on the situation related to COVID-19. This morning, Albany County has reported that there are 12 confirmed cases of COVID-19 in our county. That number compares to yesterday when we had 8. Let's talk about what's happening inside our hospital here. We currently have 2 patients in-house who we are treating for COVID-19. Both of those are on medical surgical beds, none of them currently in the ICU. Yesterday, that number was 1. We currently have 15 patients in the hospital who we are investigating for the possibility of having that. We call them PUIs, patients under investigation. That number is up slightly compared to yesterday. Our situation for ICU beds and ventilators is still significant. We have capacity there to take care of any patients who come our way at this time. I'd also like to talk about our testing site. As I mentioned yesterday, we have 2 areas outside our emergency department where the community can come to be tested for COVID-19. We have one option, which is by appointment. If you work with your primary care provider, you can have a scheduled time, come to our drive-up area, and you can be tested without leaving your car. Information on how to do that can be reached at www.amc.edu. If you go there at the top of the page, you click the link for coronavirus, and it will lead you and your doctor on how you can order that test. Yesterday, we saw 200 people scheduled appointments through the drive-thru. In addition, for those who are not able to do that, we have the option of walk-up. We have our tent is functional, and yesterday we saw approximately 200 people there as well. So we're happy to serve that need in the community. At this point, I'd like to turn it over to Dr. Venditti.
Thanks, Dennis. We continue to monitor supplies very carefully, and I'm happy that I can report to you today that we have adequate supplies of masks, including N95 masks, gowns, drapes, and gloves in all sizes to allow you to provide safe care to our patients in a manner that's safe to you. As I said yesterday, we are evaluating elective procedures on a daily basis. We're taking this very seriously. We understand the ramifications of our decisions related to this. Today, I spent 45 minutes with Dr. McKenna, Dr. Day, Dr. Roberts, Dr. Stain, and Dr. Yule, reviewing the elements necessary to provide safe care. And based on that information, what was available to us at noon today, we made a decision to continue with cases tomorrow. We will continue to do this every single day, deciding upon what's appropriate. Our virology laboratory has been working tirelessly to validate our in-house testing for the coronavirus. And I'm happy to tell you that we will begin testing samples very soon. This is going to really help us. This is going to allow us to have much faster results for those patients that we're very concerned about.
Thank you. We said that we would use this forum to answer questions from everybody. Dr. Venditti, here's a question from a staff member. Can you please clarify the criteria by which somebody is or is not allowed to work?
So when you come to work, we want to be sure that you're not infected with the coronavirus. So we don't want you to come if your temperature is greater than 100 degrees, if you're having a persistent cough, or you're having unexplained shortness of breath. If you have any of those symptoms, you should contact your primary care provider for further guidance on how to be treated.
And in a situation where you are an AMC employee and you have come in contact with a known positive patient, am I allowed to still work?
So Dennis, you are allowed to still work. So the CDC and the Department of Health have changed their guidelines a little bit. So if you are asymptomatic, you can work wearing a mask as long as you monitor yourself twice a day. Take your temperature, make sure you don't have a fever greater than 100. If that happens, either fever, persistent cough, or shortness of breath, you need to stop working and go home immediately. You also need to self-monitor for 14 days at home to make sure you don't develop those symptoms if you aren't coming in to work.
Okay, thank you very much. We'll continue to answer questions as we go forward over the next couple of days. People are asking us, how are we doing? And the answer is this. We're doing as good as we can, and we're doing that because of all of you. Dozens of situations every day, dozens of different problems are being solved. We appreciate everyone's effort doing that. Please take care of yourself. Please take care of each other. We'll see you tomorrow.